Ramadan is one of the 5 main pillars of Islam. Ramadan is fasting from dawn to dusk for a month, and this is a duty for all adults, healthy Muslims. It's not just a duty, but it is something that many Muslims are really waiting for and doing with passion. During the fasting hours, which roughly in the European area would be about 17 to 18 hours, a fasting person is not allowed to drink, to eat, or to smoke during these hours at all. Afterwards, they can do the 3 together if they wish. Obviously, that is something, as I've mentioned, for adult, healthy people. There are lots of exemptions in the teaching of the Islam, in the Quran, and the teaching of the Prophet Muhammad. Anyone who is ill, anyone who is traveling, any child, of course, women during menstrual cycle, breastfeeding, and indeed during pregnancy, and also people with reduced mental capacity are all exempt from fasting. When it comes to health, when it comes to something like diabetes, the question is, who is too ill to be exempt? And here is the need for the medical interpretation. Because obviously diabetes is a condition that varies a lot from maybe someone who's just been diagnosed and need to follow lifestyle measures compared to someone, for example, who is on dialysis or who does not recognize hypoglycemia. So a completely different level of scale when it comes to fasting, not eating and drinking. For people with type 2 diabetes wishing to fast, there might be some risks. And I stress here on the word some, because obviously the vast majority would be able to fast with no risks whatsoever. And that's been shown in data that's been compiled over the last number of years from various countries. The majority will be able to fast. Nevertheless, there would be some who would have the risks of hypoglycemia, hyperglycemia that is high enough to lead to hospitalization, the theoretical problem of dehydration and thrombosis. For people with type 1 diabetes, the extra point will be ketoacidosis. It can sometimes happen to people with type 2 diabetes during Ramadan, but the vast majority of ketoacidosis risk during Ramadan will be in people with type 1 diabetes. For a person with diabetes in general terms, whether type 1 or type 2, they might have risks, and we as medical professionals need to do our best to quantify for these risks, to put categories for the risks. How we do this is based on a number of factors. Some of these factors are related to the medical condition itself. For example, people with type 1 diabetes, they depend on insulin. Insulin as a type of drug is associated with the risk of hypoglycemia. Obviously, that with a person fasting 17, 18 hours would be higher. So that type of diabetes makes the person at a higher risk. Consequently, also the type of treatment. So a treatment with insulin is different from a treatment that does not cause hypoglycemia. Secondly is the person's medical diabetes-related issues. For example, am I aware of my hypos when they happen? Of hypoglycemia awareness, is it there or not? If it's not there, then I'm at a very high risk. Did I develop a severe hypo without warning recently? That also will put me at a very high risk. So that's another point related to diabetes. Thirdly, then, still related to diabetes, is what is my associated medical health problems? Do I have a kidney condition or a heart condition which would make my risk when I'm fasting higher? Not just because I might need to take regular medications, but maybe, for example, a person with kidney problems, they might retain the drug a bit more in their blood, and consequently the risk of hypoglycemia would be higher. So it's very much related to this. Then there are other points that are really important. These other points help in the quantification of the risk as well. Am I pregnant or not pregnant? Am I living alone or not living alone? If I'm living alone now and I'm getting into a hypoglycemia without someone telling me, be careful, you look like you're going into a hypoglycemia, that lack of other person's social circumstances. And then my job, sitting in a nice air-conditioned office, is very different from someone doing a hard physical job in the middle of the desert, for example. So that will put them at extra burden. And then lastly is the medical condition of how tight and how high is my blood glucose levels. The beauty that there is indeed harmony between the religious and the medical views on this. The medical recommendations published in 2005 by the ADA, written by a number of people with experience in this, and I was delighted to be part of that document, have quantified the medical risks into 4 categories: very high, high, moderate, and low. The religious views are in tandem with this. There was a huge meeting 5 years ago in Sharjah with the authorities of the Islamic International Organization and the International Council of Fiqh. And fiqh in Islam is the study of regulating what is right and wrong. And they have looked into that document and accepted the classification in the document and went further. They said that the first 2 levels, the very high and the high, based on the high probability of harm to the body, should not fast. While those with the moderate and the low risk, based on the low probability of harm, they have no medical reasons not to fast. And that obviously empowers the healthcare professional, especially if they come from a different faith. So that will give them the knowledge from the medical point of view, and knowing that they have the support of the religious views as well. The beauty in this document also that it has went further to explain some of the general myths that happens, unfortunately, in many societies around Ramadan among Muslim peoples. For example, one very important factor in management of diabetes is blood glucose monitoring, or blood tests in general terms. Many people thought wrongly that a blood test would violate the fasting, would break their fast. So consequently, they wouldn't attend the clinic, they wouldn't go to the doctor, or indeed would not check at home. But that's a myth. The second myth, obviously, is that some people were trying to push themselves very hard to sort of say, well, if I would even harm my body, I would be doing this for my religion. And what this decree has stated very clearly is, no, you need to seek expert medical advice and listen to that medical advice. And if you do against that medical advice, in fact, you're doing yourself no religious benefits, but the opposite. And that really is very important. The problem really is not in having this expert medical opinion or this expert religious opinion. The problem is these are not widely implemented across the globe.